right, so hi everybody. It's Lynn Polton, volunteer for ICD, and I'm here with Dr. Fugen Neziroglu, and she is a board certified behavior and cognitive psychologist and leading researcher on anxiety disorders. She's the co-founder and director of the Biobehavioral Institute in Great Neck, New York. That's a clinic specializing in anxiety and obsessive-compulsive related disorders. You're a member of many different organizations, and we're just so thrilled that you have agreed to be one of our presenters for our virtual assembly. You're going to be talking about neurobiological and neurochemical processes of hoarding disorder. What do you hope people will gain from the presentation? That's what I want to talk about, but if you'd like to just share a little bit about yourself, that would be great too.
Okay. I'm a researcher and a therapist. I started my research in the early 70s as an undergraduate trying to get into graduate school in OCD. Did the first drug studies in OCD in the United States when my husband and I brought enafrenil into the United States and started looking at the efficacy in OCD, which had been established elsewhere to some degree, but not in the US. We had no medications, no therapy for OCD at the time. There was no foundation or anything. We kind of went around trying to determine the population that had OCD. All the books had maybe 2 pages devoted to it. And so we did a lot of work in trying to disseminate information about OCD, started doing our drug studies, finally get into graduate school and graduated and brought CBT as a form of treatment for OCD and other anxiety disorders on an outpatient intensive level. And looked, continuing on in my research with OCD, looked at biochemical changes in OCD purely using CBT and found that in fact there were chemical changes with intensive behavioral therapy. From there I went on to look at disorders that were pretty similar, such as body dysmorphic disorder, hoarding disorder, excoriation disorder, Gilles-de la-Tourette, and so my interest grew from OCD and spread to the related disorders, and including obviously hoarding.
Yeah.
Yes, I will be talking about first the neurobiology, neurophysiology, the anatomy, and giving an overview of anatomy in general, and then talking about specifically how certain particular brain areas are affected in hoarding disorder, and then talking about a little bit about the medication trials and what medications may be effective for hoarding, and then a little bit about how our treatments in CBT are related to the biochemical biological bases.
And really the biggest thing is, how do we engage people in getting into treatment, right? Like,
absolutely. And I proposed a technique called the intervention, as I think that it's the most important thing I can think of actually, in terms of what family members need to do in order to get someone into treatment. And so very similar to drug addiction, you add a therapist, a professional organizer, someone who understands hoarding to actually serve as the interventionist. And then you can get the family members, all the significant people in the lives of the hoarder, to express in a non-judgmental, non-critical, loving way why they should engage in treatment. And the whole goal is that particular day that this discussion is going on with the interventionist, the family, and the person who hoards, is to get them that day in to see the therapist. And hopefully you have the treatment, lined up for that day, the consult, and then get them into, and that's the only thing they need to do. And then you have to leave it up to the professional to kind of convince them to continue and engage. And that engagement process is back and forth throughout treatment. as you
Yeah.
know.
Right. Yeah. Well, I'm so excited that we will have the opportunity to hear about your research and your experience. And thank you so much for
Thank
spending a
you.
bit of time
Thank you
with
to
me.
ICD, and thank you for taking the time to do this.